Hey guys, and welcome to MedBuys TV, where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, we're going to talk about Crohn's disease. Crohn's disease is when you have inflammation of your digestive system. This inflammation can happen anywhere in your digestive tract, but it's usually at the end of your small intestine. It is considered a type of inflammatory bowel disease, which is not to be confused with irritable bowel syndrome. IBD, irritable bowel disease, is much more severe than IBS. Crohn's disease is a chronic condition that can have pretty severe symptoms, but sometimes people don't feel any symptoms at all. Classic symptoms of Crohn's disease include severe diarrhea, weight loss, and abdominal pain. There can be other symptoms, but these are the most common. Now, there are 3 stages of Crohn's disease that we're going to talk about today. There's flare-ups, which is the presence of very severe symptoms. There's maintenance, which is the presence of symptoms, but they're not usually as bad as the flare-ups. And then there's remission, which is symptom-free and no detection of inflammation. A diagnosis of Crohn's disease can involve an MRI, blood tests, and unfortunately, some pretty uncomfortable procedures like a colonoscopy. But your specific physician may prefer or require other tests to make a proper diagnosis. What causes Crohn's? Well, we still don't know what the cause of Crohn's disease is, but it is believed that it could be genetic, so you can send a thank you letter to mom and dad. Or it could be caused by certain environmental factors, or it could be caused by an overactive immune system, or it could be a combination of all these things. Again, we really don't know exactly what the cause is. In addition, smoking can significantly increase your risk for Crohn's disease. In managing Crohn's disease, it's really important to know your triggers. Crohn's disease can be triggered by certain foods or medications. Triggers can worsen flare-ups and can cause a relapse of symptoms for people that have gone into remission. The types of foods that can trigger symptoms of Crohn's disease vary from person to person. It's usually fatty foods or gas-producing foods like beans, lentils, and broccoli. So if you're someone that's dealing with Crohn's disease, it is important that your diet include low-fatty foods and foods low in dairy. In addition, gas-producing carbonated beverages, coffee, or other caffeinated drinks should be avoided. Let's talk about the medications that can worsen symptoms of Crohn's disease. The most common class of medications that can cause symptoms of Crohn's disease is NSAIDs, and that's non-steroidal anti-inflammatory drugs. NSAIDs are ibuprofen like Advil or Motrin, which is also Advil, aspirin, Aleve, naproxen. Those are all NSAIDs that can cause symptoms of Crohn's disease. Stress can also be a trigger, so it may be time to try and minimize those stressful situations. Smoking cessation can also reduce the amount of flare-ups that you have, and it could also help from preventing relapse if you've had surgery to treat your Crohn's. Smaller, more frequent meals can also help control symptoms. Increasing exercise, drinking lots of water, and also there are some over-the-counter probiotics that can help. Now we're going to talk about how to treat for Crohn's disease. Depending on the severity of symptoms and the preference of your physician, your treatment for your Crohn's disease can start as aggressive or conservative. I'm going to include a link below to this video to a website called crohnsandcolitis.com. They have a lot of great resources for people that are dealing with Crohn's disease on how to best manage it, and they're going to have a lot more detailed information about how to treat it, diagnosis, and the certain medications that you take if you have Crohn's disease. The website also has a great description of how to break down and characterize your symptoms. There are many different treatments that your physician can prescribe. And again, it's going to boil down to the severity of your symptoms and to the preference of that specific physician. But normally the treatment options are going to include the following: anti-inflammatory medications, antibiotics. Most treatments are going to involve taking a steroid. And lastly, your prescriber might recommend some over-the-counter medications, such as antidiarrheals or other supplements to replace vitamins and minerals like vitamin B12, vitamin D, iron, and calcium. Now, there are some people who are going to require more complicated treatments than others. If your body doesn't respond to certain medication treatments, your prescriber may recommend surgery. Make sure to really get detailed with your physician about your surgery option to make sure you've exhausted all the medication options first. It is important to know that surgery for Crohn's disease is not a cure, but it's more of a way to prevent major complications and reduce the severity of the symptoms. The goal of the surgery is to go into remission, but there is a possibility that your symptoms can return even after surgery. Again, for more detailed information about how to treat Crohn's disease, make sure to visit crohnsandcolitis.com. The website is sponsored by a drug company, which I'm in no way promoting or endorsing. They just have a lot of really good info on their website. As always, please do not start or change the way you take any medications without first talking with your pharmacist or prescribing physician. That's all I have today. I really hope this was helpful. If you have any other questions, please feel free to email me at richard@medbuys.com. Thanks for watching. Take care.